Let's talk about one of the most common and most serious injuries an older person can have, a displaced femoral neck fracture. Now, the surgery to fix it is done all the time, but the choice of how to fix it? That's a whole other story. It's a real balancing act between getting the best function and avoiding the biggest risks. So today, we're going to dive right into this critical choice and see what the evidence really says.
So, this is what we're looking at. A pretty clean break right at the top of the femur, just under the ball of the hip joint. For anyone who was up and walking around before this happened, the goal is simple: get them back on their feet. The big question is, what's the absolute best way to rebuild this joint for them?
And this is the fundamental dilemma for orthopedic surgeons. Do you do a partial replacement or do you go for the full shebang? Believe me, the answer is not simple, and the debate has been raging for years. So today, we're putting the two main options head-to-head in a little showdown to see what the latest high-quality research is telling us.
Okay, let's meet our two contenders in this surgical showdown: hemiarthroplasty and total hip arthroplasty.
First up, we have hemiarthroplasty, or HA for short. The easiest way to think about this one is as a partial replacement. The surgeon takes out that broken femoral head, the ball, and puts in a new, durable metal one. But, and this is key, the patient's own original hip socket is left completely untouched.
And in the other corner, we've got total hip arthroplasty, or THA. Now this is the full replacement. Not only do they replace the femoral head, but they also go in and resurface the socket, the acetabulum, and fit it with a brand new cup. It's a complete ball and socket overhaul.
And here's what you get at the end of the day: a brand new, working hip joint. Both surgeries can get you this result, but as we're about to see, the road to recovery, the risks you take on, and the outcomes down the line, well, they can look pretty different.
So let's get to the main event. How do these two procedures really stack up when you put them side by side and look at the hard data from the big clinical trials and massive research reviews?
Kicking things off with round one: function and quality of life. At first glance, the total hip, the THA, seems to have a clear advantage. Lots of large reviews have found that THA patients generally report better function and less pain. But, and here's the twists, the massive health trial, which is a really big deal in this field, found that while the scores were a bit better, the improvement was so small they called it clinically unimportant. So it's like a win on paper, but one the patient might not even notice in their daily life.
All right, on to round two, risks and complications. And this is where the plot really thickens. You know, a total hip is just a bigger, more complex operation, and the data shows that. The health trial found a higher rate of serious adverse events with THA. But it's also super important to point out that when it comes to the really big, scary outcomes, like mortality or infection rates, there was no significant difference between the two. But check this out. This is the number that really jumps off the page. The risk of a hip dislocation, which is a major, major complication, was twice as high for patients who got a total hip replacement. That is a huge trade-off to think about, especially for what that same big trial called a clinically unimportant gain in function. And for our third round, we have the reoperation debate. For a long time, the conventional wisdom was that a total hip was more durable, meaning fewer do-over surgeries down the road. A big 2019 review of all the studies seemed to support that, saying THA was superior. But then the enormous health trial came along, one single very powerful study, and found something completely different. Within the first 2 years, there was no difference at all. And this is just a perfect example of how medical science works. One huge, well-designed study can really challenge what we thought we knew for years. So function and risk are absolutely critical, right? But in any modern healthcare system, there's another giant factor you just can't ignore. Which one of these procedures gives you better bang for your buck? An economic analysis that was tied to the health trial data gave us this pretty powerful bottom line. Basically, when you add up the higher cost of the total hip implant itself, plus the cost of treating its higher rate of complications, for the majority of patients, those small functional gains just don't seem to justify the extra money.
But, and you knew there was a but coming, and this is a huge one, the whole analysis did a complete 180 for a specific group of patients. For the younger, more active folks, in the study, anyone under 73, the total hip replacement was actually the clear winner. It was more effective, and over the long haul, it actually turned out to be less costly. How about that?
Okay, so we've looked at the data on function, on risk, on reoperations, and on cost. So after this whole evidence-based showdown, what's the final verdict?
What does this all actually mean?
Well, it really all boils down to a series of trade-offs. The total hip arthroplasty, THA, it gives you that slight edge in function, and that seems to matter most for younger, more active people. But it comes with a higher upfront risk of serious problems, especially dislocations. On the other hand, the hemiarthroplasty, the HA, is the safer, simpler, and more cost-effective choice for the typical older patient with this injury, even if their absolute best-case functional outcome might be just a little bit lower.
And this idea is perfectly captured by the official clinical practice guideline from the American Academy of Orthopedic Surgeons. They don't give a strong recommendation for one surgery over the other. Instead, they give a moderate strength recommendation for using total hip arthroplasty in, and this is the key phrase, properly selected patients. It's all about selection. So you see, the final takeaway here isn't about which piece of metal is best. It's about figuring out which procedure is best for the individual human being on the operating table. It's all about tailoring the treatment to their age, how active they are, and what their goals are for the future. And the real ongoing challenge for surgeons will be to keep finding that perfect balance between a patient's desire for function against the very real risks and costs of doing a more complex surgery.